Today's seminar, as you just outlined, is the findings of a special issue which was exploring the intersections of ageing and disability during the pandemic. And so the main sort of argument that Maria, the other editor, and myself made was that we need to have sort of an anti-ableist, anti-ageist ethics of care in policy going forward to ensure human rights and dignity in society. So the paper is, so I'm going to firstly talk about my positionality and basically highlight some of my own identities and how they drove and shaped the project. Then I'm going to talk about some of the themes that emerged from this collection, and also think about some of the ways forward in the concluding comments. So, as a feminist researcher, I start with a political commitment to produce useful knowledge that hopefully will make a difference in the lives of those suffering injustice. And I furthermore aim to challenge the silences in mainstream research in relation to issues studied, but also the ways in which they're studied. As I'm sure you're aware, feminist research is change orientated, so this paper is trying to challenge some of the ways in which older and disabled people are understood. And as Leatherby states, research is political, so from the chosen topic to the manner in which it's carried out. My positioning as someone who has a chronic health condition and was immune suppressed meant I was shielded during the lockdowns in the UK and experienced social isolation during the pandemic. And subsequently, I felt some affinity with some older and disabled people's experiences. However, I also acknowledge my own privilege as a white, relatively young, middle-class woman who actually had the privilege of being able to shield in the first place, unlike some of the sort of people that are highlighted in the collection. So the frame of this paper is sort of personal and as well as political, as you know, the well-known feminist adage states, personal is political. And although ageism and ableism, shouldn't be conflated, I think the pandemic has brought together two groups that had some similar experiences of discrimination, isolation, and invisibility. So I intended to use these shared insights to bring light discrimination against older and disabled groups in the pandemic and argue for their rights in society. So before I get into the themes, I'm just going to give a bit of an overview or contextualization of the special issue. So I was approached at a BSA annual conference to put forward a proposal for a special issue. And I did because I felt that, the pandemic illustrated to me the intersectional experiences of older and disabled people were really under-researched and still are. And the sociology of ageing and disability and health and illness are fields of research that do have a lot of crossovers and intersections and convergences, but there is still a lack of research across these corpuses. And I think it also reflects the neglect of the sociology of ageing and disability in mainstream sociology more broadly. So although the pandemic has illuminated these experiences for older people and just people with disabilities, disability and age have often been conflated. And recently, Van Hurst and Vickerstaff have tried to tease out ageism and ableism and argue that they should be separated out. And so there is growing discussion about these intersections, which is encouraging. So whilst there are some shared experiences of discrimination and precarity between older people and persons with disabilities, there's also some important divergences, historical, political, and theoretical underpinnings in these corpuses of work, which need further exploration. And I think wanted to open up the potential for conversations and possible connections across these fields, whilst also like respecting their differences as well. So the collection drew together this like myriad of epistemological, methodological perspectives to explore these different corpuses of work, and they cover different countries in the global north, Canada and Switzerland, as well as the UK. So whilst, you know, there is a small collection and, you know, it's within the global north, so there's limitations obviously to the project, it still, I would argue, has some really rich in-depth findings around these particular groups that could be transferable to similar populations. So within the ageing and disability nexus, we found the following themes. So ethics and necropolitics, temporality, and accessibility, and also agency and resistance. So in mine and Maria Berghs' paper, who's the co-editor of the special issue, the themes of necropolitics and ethics came through and drew attention to the impact of the failures to care for groups during the pandemic, these groups. So my paper is entitled From Bare Life and Necropolitics to a Feminist Ethics of Care, Ageism in COVID-19 Pandemic and Future Directions. And it illuminated how necropolitical decision-making was based on age as a proxy measure for health. And this was used to determine who got treatment, who didn't during the pandemic. And a number of exceptional practices took place to ration care, and exceptional in inverted commas. This was particularly in the first wave, like triaging tools, which I'm sure most people have heard of, which equated to being over 80 as likely to receive no sort of treatment, and in some cases, regardless of availability or chances of survival. And these practices can contravene human rights and equality legislation, but they're not discrete instances. They can be seen as part of a continuum, which due to neoliberalism and austerity measures in the UK, often reduces older people's treatment in health and social care system to sort of bare life conditions outside of legal protection. So I argue that care ethics needs to shift from employing like these universal, impartial, ethical frameworks like utilitarianism, where the individual needs are assessed based on societal benefit, to a feminist care ethic, where considerations are made regarding inequality based on intersecting inequalities of age and disability, and efforts are made to equalise power relationships, addressing injustice within the whole system of health and social care. And we need to shift away from these old exploitative models, which dominated by sort of large multinational conglomerates, which lead to sort of rationing of care. And we need to move to more relational, therapeutic, reciprocal approaches, which integrate care ethic characteristics of attentiveness, responsibility, competence, and responsiveness within all stages of the care system, from organising care to delivering care, and then afterwards. Whereas Maria Berghs' paper entitled The Indignities of Shielding During the COVID-19 Pandemic for People with Sickle Cell, she used an interpretive phenomenological analysis and discussed the intersecting discriminations of being a minority ethnic group, and in some cases older and having a chronic health condition. And so her paper really highlights the intersecting structures of inequality that are discussed and the emotional impact this had on this population, specifically the fear of being triaged and there not being anyone there to advocate for them if they're admitted to hospital, and the ableism alongside racism, which contributed to their condition being placed lower down the hierarchy of illnesses, which are taken seriously in the provision of care services. For instance, her paper highlights an instance where they were assumed to be a drug addict and not worthy of treatment. So the main theoretical contribution of this paper is this idea of this ethics of crisis. So this encapsulates the principles by which participants with sickle cell had to live their lives preparing and expecting a next health crisis, and was exacerbated by societal and care service treatment. This is just a quote from my paper around the triaging of older people. So 9 points originally given for being 80 years old, and that was enough to pass the threshold for being refused treatment. However, this is readjusted to allocate more points for existing health conditions, fewer points for being over 80. Nevertheless, these were reports of a revised tool being rigorously applied, even there were reports of a revised tool being rigorously applied, even when beds and ventilators were available. So people over 80 were confined to what one family member called as a death ward. And there were other quotes as well in Maria's paper around, them not being worthy of receiving treatment when they went to hospital. So Maria's paper also makes some important theoretical contribution in relation to the concept of time and how this group experienced time during the pandemic. And it sort of sped up and slowed down during lockdowns. So chronicity didn't really correlate with a specific temporality, even when described pandemic time as being quite similar to their everyday lives. They found in relation to age and disability, for some, there was like an inverse relationship. So when people age, they actually move from acute to less disabling chronic status. And there was a highlighting that crip time for this group was linked to the care of self and others. So for them, it was a way in which they had to think always, planning ahead and trying to prevent the next crisis. So the theme of temporality was also present in Jamie McFarlane's work, which was a really interesting paper entitled Greying Arts Access, Crafting Creative Online Programming to Promote Older Adults' Artistic Engagement in and Beyond Pandemic Time. And this paper reports on a participatory design based in Canada, and it contributes to some really important perspectives on some unintended consequences of the pandemic. For instance, during the pandemic time, enhanced access to the arts. So people growing older with or into disabilities were actually able to access more creative arts creative arts activities. And so their innovative findings point to a shift from pandemic time, when virtual spaces were adapted for wider society and improved inclusivity of older and disabled people, back to normal time, in-person interactions, which excluded those who will continue to remain at a risk of COVID, or where spaces are designed for normalcy. And it was also sort of a design that really critiqued this idea of techno-ableism, which is the notion that technology can sort of cure disability, and it was very much placing older and disabled people at the centre of the design of the technology. It's a sense of empowerment and agency. So here's a quote that quite encapsulates this shift from pandemic to normal time. So the pandemic really stood out for me as someone who's becoming more physically limited, at how much more accessible things were made for people. And now that everything's moving back, most things are moving back into in-person experiences. And I'm sort of sitting here going, well, what do I do with myself? And it really hits home for people who've got accessibility issues and mobility issues, for whom this was their whole life before the pandemic, and they were given a bit of a lease of life through the pandemic, and now they're being shut out of spaces. I see this particularly with two art and craft groups I'm a member of, about how people have been kind of desperate to get back into in-person meetings, and a small number of people saying the only reason I could come to every meeting was because it was online. So it's been really interesting time, I think, to think about these things. I'm pretty sure we're just going to go back to the way it was. So this was in 2022 when the Omicron virus was taking hold in Canada. But nevertheless, as McFarlane states, although they found strong evidence for remote creative participation, the concept of like one size fits all approach to accessibility, particularly with older and disabled adults, isn't really the case. It sort of needs to be tailored and given lots of different options online and in person. So it's simplistic to say that, it should all be in one mode. So McFarlane et al. State that, highlighted the need for technological advancement to be designed with and not just for older and disabled groups. So they point to the way in which it can, digitization can include, whilst also simultaneously exclude, groups with less digital literacy. And this is something also that Koenig and Seifert, another paper in the collection, found when they analysed a large-scale survey in Switzerland of older people's internet usage. So although there's a growing population of older adults using the internet, the picture is complex. So gender differences continue in Switzerland, with women using it less, but that gap is decreasing. And class-based indicators, as you would imagine, are also still prevalent. And those that have never used the internet obviously are continuing to be digitally excluded. Further interestingly, they couldn't find that COVID-19 had any significant difference on digital adoption for old age groups, despite its perceived importance ensuring social bonds. So their findings also point to a focus on including and making accessible technology for older people. Obviously, it's based in Switzerland, so they do point out that it's not necessarily generalizable to everyone in the global north or and global south, obviously. So this is a quote from McFarlane. So this paper complicates dominant ageist and ableist notions that older adults and disabled people are digitally incompetent and or unwilling to learn new technologies, and invites career access making communities and spaces to consider and take seriously older adults as a community who may also require and want digital access. So really highlighting the need for agency and the voices for older and disabled people in digital spaces, and co-production being something that really needs to be central to digital technology and production. So leading on from this, there's a need to use participatory research designs to challenge ageism and ableism in digital technology and agency, and resistance is the final theme that was highlighted in the collection. So this was exemplified by Al Namkani's article, who's actually was at Cardiff University. Her article was entitled "A Narrative Case Study of an Older Disabled Muslim Woman During the COVID-19 Pandemic in the UK." And she writes a really powerful, in-depth account of one disabled older Muslim woman and her experiences of multiple forms of discrimination during the pandemic, and as I say, really powerfully illustrates the indirect impact of the COVID-19 restrictions had on their experiences of disableism, but also sexism, ageism, and racism. And it narrates the experience of this gender-based abuse that she experienced on public transport. And, however, the main thread of contribution is around the assertion of agency. Because despite all these negative experiences of stigma and abuse, this woman, Zora, refused to be labelled as a victim and instead asserted that she was brave for acting against her abuser by reporting it, and thus she felt she was addressing the collective safety of women in society. But it did have a lasting effect on their willingness to use public transport. So this piece highlights the impact that political decision making, particularly in lockdowns, needed to really seriously consider the impact of social spaces like public transport and how policy decisions make some groups and not others more vulnerable. For instance, in this case, in the lockdown, there was less people using public transport. So there was no one there to witness what happened to her. And I think, we've seen similar instances throughout the lockdowns where there was no one there. So actually, sort of the decision-making created unsafe spaces where the abusers could enact their abuse unchallenged and without surveillance. So this is a quote from Zora about feeling brave and this idea of like vulnerability being fluid and shifting. She says, "I don't feel vulnerable in general. Before that day, I thought I was a strong person who's brave and I'm not afraid of anyone. And then I realized that because I froze, it means that I'm not. But I videoed it." So it's sort of like, sort of contradictions and this idea of, vulnerability being fluid and, shifting in space and time. Which leads me on to the main contribution I think this collection makes to sociology, and that's in relation to the concepts of care and vulnerability. I think it also, as I say, contributes to the sociology of age and disability, as obviously these areas are under-researched. So I argue that I think that's the groups who lack power in society, in particular times and spaces, exacerbated through political decision-making, are intensified by neoliberalising public services and austerity measures in the UK. And a disproportionate number of ethnic minority, older, disabled and chronically ill populations have been failed, and COVID-19 has highlighted this and exacerbated it. Tragically, the deaths and long-term illnesses are testament to this. So therefore, whilst curating this collection, Maria and I noticed how easily the responsibilities of care, ethics of care, could be suspended and broken, allowing for these careless spaces and times to proliferate. Therefore, demonstrating that vulnerability is fluid and existential, but I would argue it's produced through political decision-making. However, we also observed how care changed during the pandemic in new potentialities, and how we work and live, making art, work, education and health for some older and disabled people more accessible. And we're caring for those historically excluded. So, we're all aware the pandemic exposed the loss of, some, the rights of some older and disabled people. And, it has illustrated these critical commonalities the two groups had. Maria and I, as sociologists with related personal and professional experiences, wanted to explore what could be learned from it. Considering the general positive trajectory of life expectancy, not enough's been written about the experiences of aging with and into disability. And this will be vital to ensure that growing older with a disability, or if you're older and have an impairment, that these people are cared for with dignity. And a myriad of epistemological and methodological perspectives in this collection helps to understand how to situate a better future of care for care. And finally, these original epistemological and methodological insights demonstrate that a new anti-ableist and ageist ethics of care, anti-ageist ethics of care, is needed to ensure human rights and dignity for older disabled people. and putting the practice of equalising power relationships and access and participation central to all policy decisions. So it's vital the government learns the lessons in designing future services, and they more effectively address the systematic and overlapping discriminations that this collection highlights. So yeah, thank you for listening. Some references, and I also just want to acknowledge all the contributors to the special issue, and Maria Berghs from Montfort University, and Anne Leahy from Maynooth University as well, who both contributed to the special issue as editors. So yeah, thanks for listening.